Okay.
Okay. Hello. We are doing Breastfeeding 1C. This is our third class of prenatal breastfeeding education. I have no conflicts and no disclosures. I am Tameka Jackson-Dyer, IBCLC. I am the EMU CDC Reach Lactation Consultant and Breastfeeding Subject Matter Expert, as well as the Wayne County Healthy Communities Clinic NACHO Grant Lactation Consultant. I also work in a lot of other organizations, project consultant for Cofective, which you'll see some of their materials in today's lesson. I'm the owner of Crazy Milk Lady Lactation Support Services. I'm the chair of the Metro Detroit Wayne County Breastfeeding Coalition and co-founder of Southeast Michigan IBCLCs of Color. But most importantly, I am a wife and mom with almost 4 years of personal breastfeeding experience. The objectives for today's class are to dispel the myths regarding breastfeeding, discuss the importance of exclusive breastfeeding. We're going to be educated on the risks of formula feeding and getting breastfeeding off to a good start, the magic hour, which is the first hour after birth, how to handle newborn procedures in the hospital, answer any questions or concerns you may have. Obviously, you'll need to email me or email CDC Reach, and discuss breastfeeding during COVID-19. So today we're going to talk about falling in love, meeting the love of your life on baby's birthday. Skin to skin is so important, and you'll hear about this a lot, but skin to skin is like a reset button for babies. It is a way to help them get used to being out here in the world because it's scary. Being born is hard work. Not just for mommy, but for baby too. And so it's very loud, it's very bright, there's a lot of stuff going on. And when they go skin to skin, it puts them as close as possible to what they're used to. They can hear your heartbeat just like they did on the inside. They can feel the vibrations from your voice when you're talking. You're soft and warm. They know your scent. And it puts them close to the food. So it's good stuff. And so you just lie back slightly in the hospital beds, make this really easy because you can recline it to the angle that's most comfortable for you and place them on you bare skin to skin. So that means open up the hospital gown, take off the cute little nursing robe that you bought, unwrap baby out the blankets, and put them skin to skin with you. That helps to regulate their breathing, their heart rate, their body temperature. It just helps them get used to being out here. Don't worry about them being cold. Being skin to skin with mommy helps them to stay warm. You can put a little receiving blanket over their back to help them, if it seems more comfortable. But skin to skin is the most important thing. The magic hour is that first hour after delivery when baby is alert and calm. Obviously, if you did not have any medications during delivery, it's a lot easier for them to go through the 9 steps to get to the breast. They will get there on their own. They know where it's at and how to get to it. You just have to give them access. And they go through these steps to go from being born and first feed. If the process is interrupted in any way, they won't just, like if the nurse comes and takes them to go do a test or something and they're on step 4 and she brings them back, they don't go to step 5. They start all the way back over at step 1. So it's very important that they have this uninterrupted time with you. Okay. You'll watch them latch, get on there all by themselves. You've never seen, a cat, a dog, a cow, a monkey, anything like needing to figure out how to show the baby how to get to the breast. We are mammals too, and our babies know where to go, just like all those other mammal babies. Okay, now we're going to watch this video. Okay. All right. I need to escape. Stop the share. Get to the video and reshare. Okay, so how do I do that? Nope, I'll do that. And
not hearing any sound.
Okay. I don't understand why it's not working. Now we're going to watch the video. Here and go.
UNICEF, WHO and WABA, along with the scientific community, strongly recommends initiating breastfeeding within half an hour of birth. Evidence shows that early initiation can prevent 22% of all deaths among babies below 1 month in developing countries. Yet, no specific method of initiation of breastfeeding has been widely recommended by the scientific community. In the current scenario, where high rates of undernutrition in young children is prevalent, which is 46% in India according to NFHS3, coupled with high morbidity and mortality, we in Maharashtra felt a dire need to identify evidence-based workable method which is easy, replicable and cost-effective. It is also known that like the young ones of animals, even human babies can initiate breastfeeding on their own, provided they are kept between mother's breasts. This is known as breast crawl. Government of Maharashtra, Nutrition Mission, ICDS and BPNI Maharashtra jointly with UNICEF has initiated an ambitious program to train government NGO functionaries in basics of infant and young child feeding. The miracle has moved one and all, from the grassroots health workers to the highest bureaucrats, and they have accepted it as the answer for early initiation. Soon after delivery and after the baby has cried and started breathing well, baby is shown to the mother and kept close to her with a cheek-to-cheek contact. This helps the mother to kiss the baby and also facilitates the local custom of saying a holy message in baby's ear. Subsequently, baby is kept prone in between the breasts. All care should be taken to prevent the baby from falling. If the weather is cold, then baby should be covered with a warm cloth. Baby is very alert soon after delivery and hence is at its instinctive best. Baby is also kept warm, being in close contact with the mother. Baby is also prevented from future infections because she starts acquiring healthy germs which will colonize her skin and intestines. Thus, this position ensures early instinctive stimulation and gives warmth, love, security and also food. It also initiates bonding process between the baby and the mother. Kicks will give tender, firm jerks to the womb, stimulating it to contract. This will help to expel placenta and reduce bleeding. Once baby realizes that food is in close proximity, it starts salivating. Smell is a strong stimulus which drives the baby towards the nipple. Baby's smell sensation is well developed. Smell of a chemical on nipples is similar to the smell of a chemical in amniotic fluid, which surrounds the baby in the womb. Mouthing movements start. Her shoulder, hip and neck muscles are sufficiently developed to help her move. Baby with her limited vision can see the areola. If baby raises her head, it can also see mother's face. Baby has reached the nipple, has raised her head and has nicely lashed it with wide open mouth and mouth full of breast. What a beautiful moment of joy for the mother and the child. This baby has reached the destination in just over 10 minutes. Majority of babies will successfully complete breast crawl in about 30 to 60 minutes. Like all other gifts of nature, this comes free of cost. However, the health and nutrition benefits offered will save millions of lives and will save billions in terms of health cost. It will create a generation which will reach highest human potential of growth and development. We request you to carry this message to all future mothers and their families to prepare them to experience this miracle. Train every health worker in the maternity service to help every baby and mother to initiate breastfeeding by nature's way.
Okay, so now let's get back to the PowerPoint. And as you saw,
There is no
said that you're
period more critical in a
supposed
child's
to
development than the
make sure
first
that baby
1,000
keeps
days of
some
life.
amniotic. Okay, so in the video it said that you're supposed to make sure that baby still has some amniotic fluid on their hands, and that's important because it helps to guide them to the breast. Your Montgomery glands, there's the dark spots around your areola, the dark circle around your nipple that kind of look like moles. Those are actually sebaceous glands or oil glands that releases a fluid that helps to keep the nipple moisturized, which is why you don't need to put any lotions or oils on your breast to keep it moisturized, but it helps to clean and moisturize the nipple. And the fluid is almost identical to amniotic fluid. So it makes the darkness of the reason why your nipples and areola get so much darker during pregnancy is it acts like a bullseye because babies, newborns see really good in contrast, which is why a lot of like the mobiles and the toys are in black and white. And so they can see it better. And then the smell is there that smells like home where they just came from. And it helps them find the food. We are so amazing. Okay. No, I don't want you to do that. Let's go back. Okay. So the first feed, like it's in the video, you let them stay at the breast, doing skin to skin until they have completed the first feed. That usually happens in an hour. The magic hour usually happens within the first hour. If you had any kind of pain meds or medications or you had a long, rough labor, it can take a little bit longer for baby to get themselves together and oriented to complete the first feed. So you should be able to relax and enjoy the first feed. That means it should not hurt. Pain is your body's way of telling you something is wrong. If it is hurting, something is wrong. Ask for help. Okay. You can delay all of the procedures. They put the ointment on the baby's eyes. They poke their eyes and thighs. That's what they call it in the hospital. So they put the ointment on their eyes and they give them a shot in their thigh. They will take them to, weigh and measure and do all of those things. A lot of the stuff can wait, or they can do it while baby is skin to skin with you. You see here, they're doing a hearing test and baby is still in mama's arms. They do not have to take them away from you. That's very stressful for them and for you. Okay, the standard newborn procedures, the vital signs, checking their heart rate, their breathing, the Apgar score that tells us how well baby is adjusting to being out here. They take it at one at 1 minute and one at 5 minutes after birth. Vitamin K, that's the shot that they get in their thighs. It helps babies to clot to make sure that they don't have any bleeding. The eye cream, if you've ever seen pictures of newborns or seen a newborn, they have like their eyes are like all swollen and shiny. That's from the cream. They do a heel stick, which they use to test for all of the, there's a whole panel of diseases and syndromes that they test for. And so the blood that they get from that heel stick tells them, they put it on a card. They do the hearing test, and then they also check their oxygen levels. They do not need a bath. Remember, you want to keep amniotic fluid on those little hands. They're not dirty. That white creamy stuff is called vernix. It's actually a skin protectant. You can rub it into them like lotion. It helps to keep them. It's what kept them from getting all wrinkled up and dried out while floating in the amniotic fluid. So, what is in your milk? Your milk is 87% water, 87.8 to be exact. So it's almost 90% water. So babies don't need any extra water. They're getting all the water they need from your milk. It's 7% lactose, which is the source of energy. That's that milk sugar. Um, I like to point out that saying that you're lactose intolerant, which I am, is actually incorrect because all mammal milk has lactose. So if you were lactose intolerant, you wouldn't be able to drink human milk either. What is correct is that you are cow's milk lactose intolerant. One, because you're not a baby cow. So being lactose intolerance is not exactly right. Human milk is 4% fat and 1% protein. So this tells us that it is species specific. It's made specifically to grow human babies. We obviously need a lot of water, and we need that sugar, that energy, in order for our babies to grow properly. Hey, what's in a drop of the good stuff? So some of the life-giving components, every single drop of your milk, every drop um, has water, proteins, lactose, essential fatty acids. That's what's needed for like muscle and brain growth, antibodies to help build and protect their immune system, hormones and growth factors, millions of live cells. Your milk is alive, like stem cells and white blood cells. We hear a lot about stem cells from like bone marrow and stuff like that. But it's stem cells in your milk, and those are cells that can turn into anything. Like they can become, a stem cell can become a heart cell or a lung cell or a muscle cell. And that's what gets into baby system. And that's one of the reasons why they're healthier, is because it can help to rebuild organs throughout the body with these stem cells. At around 800 strains of good bacteria, gut bacteria is very important to our physical health. Antibacterial and antiviral enzymes, so they help to break down viruses and bacteria that get into the body, and then vitamins and minerals. And the coolest thing ever is that as baby grows, your milk changes to meet whatever their specific needs are. So get ready to fall in love on baby's birthday.